I'm Peter Morley, and I'm a patient advocate. For more than 5 years now, I have been working to protect and expand healthcare for all. For me, it's personal. I live every day with lupus. I've had 3 failed spinal surgeries, and I have survived cancer twice. I am fighting for my own right to healthcare, but also for millions of others in every corner of this country who need and deserve access to affordable healthcare. I recently co-founded Healthcare Awareness Month, which aims to raise awareness of the work being done to improve healthcare in America, work that all of us here are doing every single day. I have traveled to Capitol Hill more times than I can count. I've testified before Congress, met with members and their staff, and raised awareness in the media. In all that time, I can tell you that there has been no bigger champion for healthcare, no better guidepost for progress than Speaker Nancy Pelosi. During her time in Congress, Speaker Pelosi has shepherded major healthcare wins that have improved our nation's health, including strengthening Medicare and Medicaid, passing the ACA, and keeping House Democrats united against the constant attacks to our healthcare system. I am proud to be one of millions of Speaker Pelosi's VIPs. That means volunteers in politics. And I'm so grateful that we have her in our corner, fighting for the people as we continue the important work of improving our nation's health and healthcare. So without further ado, it is my sincere privilege to introduce Madam Speaker Nancy Pelosi.
Hello. As House Speaker, it is my privilege to bring greetings from the Congress to this group of passionate healthcare advocates as you gather virtually for the annual Families USA Health Action Conference. Thank you, Peter Morley, for your introduction and for sharing your story of overcoming adversity and your powerful advocacy for patients. Stories like yours are the most eloquent illustration of the urgent need for our work in Congress. Let us also salute the strong leadership of Frederick Isasi, who brings years of policy experience to the fight for health equity. Thank you for being a leader in the fight to cut the cost of prescription drugs, especially this fight last summer when we shone a bright light on Big Pharma's outrageous price gouging alongside Chairwoman Carolyn Maloney and the Oversight Committee. Thank you, Families USA. For more than 4 decades, you have been a strategic partner for progress for our House Democratic Caucus in the fight for equality, affordable health care for all. You, Ron Pollock, and many others were absolutely essential, from enacting and defending the Affordable Care Act to ending the devastating practice of surprise billing, and so much more. This year, your clarion call for health justice now is particularly timely. For too long, shameful health disparities had left far too many communities of color and low-income families behind, with zip codes often determining health outcomes. And as we have seen over the past 2 years, the COVID pandemic has only exacerbated these challenges. As our nation continues to battle the pandemic, President Biden and the Democrats in Congress are fighting to build back better, which means leaving the health and well-being of no American behind. In our historic American Rescue Plan, Democrats delivered a crucial first step toward this goal as we work to crush the virus. This life-saving legislation made it easier to find coverage that meets families' needs at a price they can afford, helping to close disparities in coverage and saving the average family to only $2,400 last year. Indeed, it is with great pride that today we can say, thanks to Democrats' leadership, health care is more accessible and affordable than ever before. But Democrats will not relent until we achieve quality health care for all. This includes enacting our House Build Back Better Act, and we are committed to passing legislation that will slash the prices of prescription drugs, lower the cost of coverage on ACA exchanges, expand access to home health care services, improve maternal health outcomes, especially for Black moms, close the Medicaid coverage gap by expanding ACA to include those eligible for Medicaid in states that chose not to expand Medicaid, and so much more. And as we do so, we will honor our healthcare heroes, often women and women of color with more jobs, better wages, and stronger benefits. Health equity is a moral imperative, an economic imperative, and a public health imperative in our work to build a brighter, healthier future for all. On behalf of the House, thank you for your steadfast partnership in the fight to honor this essential truth. Healthcare is a right, not a privilege. We cannot succeed without your outside mobilization. So best wishes for a productive conference.